India has reported another record number of coronavirus deaths as a devastating second wave continues to overwhelm health facilities. Another 3,293 fatalities were reported on Wednesday, pushing its official COVID death toll past 200,000. It's the fourth country to reach that milestone, but experts fear that the true number is actually far higher. The past 24 hours also brought more than 360,000 cases, the world's largest single-day total yet, taking India's overall infections since the pandemic began to nearly 18 million. Well, the World Health Organization says in the past week, India accounted for 38% of the world's 5.7 million confirmed cases. Elizabeth Puranam has more now from New Delhi.
After failing to find help at medical facilities, family members of COVID-19 patients bring them to a tent outside a Sikh temple on the outskirts of Delhi. Volunteers here are providing oxygen for free, often driving long distances to find stockists.
We are searching oxygen all over India, all over Delhi, to Chandigarh, Ludhiana, Haridwar, Jaipur, and all our nearby cities from 200-400 kilometers far.
Family members of patients too have travelled for hours to bring them here.
It has taken 2.5 hours for me to commute from my place and come here for this oxygen, so I cannot take back her without an oxygen. So I have to give it to her no matter how much time it takes. I have to wait here.
India is seeing shortages not only of oxygen but of hospital beds, diagnostic tests and vaccines. Vaccination centres in the worst affected state, Maharashtra, ran out of doses again on Wednesday.
They're telling us that injections aren't available here as vaccines haven't arrived. I registered to come here 3 days ago, all the way from Chembur to Bandra. I only found out after coming here there's no proper information. They tell us to call the helpline number and come back in the morning.
The World Health Organization says the low rate of vaccinations is one of the reasons for India's surge in cases. The US is sending raw materials so India can manufacture more of its own vaccines, and many countries are sending oxygen and other medical supplies. While crematoriums work day and night to keep up with demand, mass cremations have become the norm.
The crematorium behind me has been working from 6 in the morning until midnight, but because it doesn't have enough pyres to cremate the bodies which are being brought every day, it had to build 20 in the park next to it, and now these 50 in this open space.
Those who've lost family members say they went through the same struggle to cremate their loved ones as they did finding them a hospital bed when they were alive.